In this video, here's what we'll cover: what perfectionism really is, the two faces of perfectionism, how it fuels anxiety, depression and OCD, evidence-based treatment with CBT and ACT, knowing when to seek help. You check an email 5 times before you send it. You spend hours polishing a report that should have taken 1. You lie awake replaying a conversation, certain you said the wrong thing. You reach a goal, feel satisfied for a moment, then quietly raise the bar again, because the win never feels like enough. Our culture often treats this as a virtue. We call it having high standards, being driven, caring about quality. But in my practice I see the other side of it every week. This is not excellence, it is perfectionism, and research increasingly shows it is one of the most significant risk factors for our mental health. Let me start with what perfectionism actually is. It is not simply wanting to do well. It is tying your whole sense of worth to being flawless, and treating any mistake as proof that you have failed as a person. A recent study from UNSW Sydney and St Vincent's Hospital found that perfectionism is strongly linked to the severity of anxiety, and that it feeds generalized anxiety disorder, or GAD. And this is not only a private struggle. Longitudinal research shows perfectionism has risen by about a third over the past 3 decades among university students, driven by social media comparison, academic pressure, and financial uncertainty. It is a cultural pattern, not a personal flaw. Research describes 2 sides to perfectionism. The first is what we call perfectionistic strivings. This means setting high personal standards and working hard to reach them. In moderation, that can be healthy. It can drive genuine achievement. The second side is what we call perfectionistic concerns. This means harsh self-criticism, a deep fear of making mistakes, constant doubt about your own choices, and worry about how others judge you. It is this second side that is consistently tied to anxiety, depression, eating disorders, OCD, and burnout. The trouble is that the 2 sides usually travel together. You set an impossibly high bar, and then you punish yourself without mercy when you fall short. The result is a relentless cycle. You achieve, you feel briefly satisfied, you raise the bar, you fall short of the new bar, you criticize yourself, you feel anxious or low, you try even harder, and around it goes again. Perfectionism does not just sit alongside these struggles, it actively drives them. In anxiety, it turns small mistakes into catastrophes. A minor error at work becomes proof that you're incompetent. A slightly awkward moment becomes evidence that something is deeply wrong with you. In depression, perfectionism opens a painful gap between who you are and who you believe you should be. That gap breeds hopelessness, worthlessness, and self-loathing. In OCD, perfectionism drives what we call just right obsessions, checking rituals, and an unbearable sense of doubt, until the need for certainty becomes a kind of prison. And in burnout, perfectionism refuses to let you rest. You cannot delegate, because you fear no one else will do it right. You cannot take a break, because you might fall behind. Researchers describe perfectionism as a maintenance factor. That means it keeps these conditions going, even after the things that first triggered them have passed. This is one reason it is worth addressing directly. The encouraging news is that perfectionism responds well to treatment, and the work is practical and time-limited. CBT, cognitive behavioral therapy, has the strongest evidence. A systematic review found that CBT reduces perfectionism with medium to large effect sizes, and lowers anxiety and depression at the same time. In my practice, that work involves spotting the hidden rules you live by, such as if it is not perfect, it is a failure. We then test those rules with small experiments, like deliberately handing in good enough work and watching what actually happens, which is usually far less dramatic than you fear. We challenge all or nothing thinking. We build your tolerance for uncertainty, and we grow your capacity for self-compassion. ACT, acceptance and commitment therapy, adds another layer. It helps you step back from perfectionistic thoughts, get clear on what you truly value rather than what perfectionism insists you should value, and make room for uncomfortable feelings without using relentless standards as a shield. For many families across the Hills District, where academic, professional, and cultural expectations can run high, this kind of psychological flexibility can be a genuine relief. So when is it worth reaching out? Consider support if your standards cause you more distress than satisfaction. If you put things off because the fear of doing them imperfectly stops you from starting at all. If you feel physically worn out from the effort of keeping your standards up. If your relationships suffer because you hold others to the same impossible bar. If you notice your self-worth rests entirely on what you achieve. Or if you suspect perfectionism is quietly driving anxiety, depression, OCD, or burnout. You do not have to earn help by hitting rock bottom first. And you do not have to keep proving your worth through exhaustion. Perfectionism is treatable. And good enough truly can be good enough. At Potentialz Unlimited in Bella Vista, we offer evidence-based therapy for these patterns. With telehealth available right across New South Wales, you can read the full guide, or book an appointment, using the links in the description below. Before you go, here's a quick recap of what we covered. What perfectionism really is. The two faces of perfectionism. How it fuels anxiety, depression and OCD. Evidence-based treatment with CBT and ACT. Knowing when to seek help.